Good evening, good afternoon, and good morning. This is the 1237th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, we have a guest in Professor Dr. Partha Chakraborty. I invite Dr. Bob Lim to moderate the English session tonight. Dr. Bob Lim is the coordinator of IFPH from Malaysia. So Dr. Partha Chakraborty is also from Malaysia. So it is the Malaysian team is here to do the session for IFPH tonight. Welcome, Dr. Bob Lim, and welcome Dr. Partha Chakraborty and all others.
Thank you very much, Dr. Danesh. It's been a very honor and pleasure to be the moderator for tonight's webinar from Malaysia. And our distinguished speaker tonight and guest is Dr. Partha Chakraborty. He is the Associate Professor of the Lincoln University College of Malaysia. And he has many awards. He's a winner of the FF Homeopathy International Award, and he holds the MD in homeopathy with over 26 years of experience, a rich experience in medical patient care, and he have done a lot of consultancy and wrote some papers, research papers on many subjects. And I think with all those extensive years of experience, we would like to know more from him, sharing his experience with us. So tonight he's going to share with us two acute cases. That is going to be very interesting because he has chosen some special cases for us today, two acute cases. So he has many others right up. You have to read on the data yourself because we're not going to spend more time on this. We want to hear more from him. So if you want to find out more about Dr. Partha Chakraborty, you can refer to the flyers by the IFPH International. So without much ado, I would like to invite Dr. Partha Chakraborty, Associate Professor from Lincoln University College, Malaysia, to present his sharing and paper tonight. Over to you, Dr. Partha Chakraborty.
Yeah. Good evening. Am I audible?
Yes, sir.
Yes, you are. Yes, you are.
Okay. Thank you very much. Very good evening, everybody. Dr. Dhanesh, my respected PG sir, Dr. Shani, my very good friend, Dr. Bob Lim, Dr. Beatrix, everybody. Actually, I'm very thankful to IFPH for inviting me once again to deliver. I went on a hiatus, actually. I was absent for a few months anyway. So let me present today's case. Share the screen. Is it visible, Dr. Dhanesh?
Yes, sir. Yes, sir.
Yes, sir. Yes, sir.
Okay. Thank you. Yeah, actually, I was thinking of presenting another brain tumor case, but my wife told me that present something else. People will be bored with brain tumor cases. So I thought that I will come up with something, some acute cases, because since the last 27 years, uh, I have heard many doctors telling that we are specialists in chronic cases. We deal with chronic cases. In India, we see the signboards are writing doctor this and this, specialist in chronic cases. And many are actually telling that we don't see acute cases, we don't have the time. We are specialists in chronic cases. But I remember one dictum I learned from my teacher, Dr. Sunirmal Shakar in NIH, when I was a student in NIH around 27, 28 years back, and 30 years back. he used to tell us one thing, that one who is a master of acute cases will definitely be an expert in chronic cases. So I thought that I need to present some acute cases. In my practice, in my own practice, I see a lot of chronic cases as well as acute cases. And according to my experience, I've seen that these acute cases are always not acute cases. They are actually acute exacerbation of chronic cases, which Hahnemann has every time told that uh, these acute cases, they present before us with some acute problems, some serious problems. But behind that, there is a long chronic case. So the two cases that I'm going to present before you today, they are actually I've termed as acute cases, but these should be termed as acute exacerbation of chronic cases. They are actually deep pathological cases, but presented before me in an acute form. Now, why acute cases are very important for us to learn? Because in our initial years of practice, when we start practice, especially in India, I've seen that many acute cases come to our clinic. Even after you become an established practitioner, physician, chronic cases will come, difficult cases will come. At the same time, acute cases will also come. And we have to identify that these acute cases are actually the tip of the iceberg. The iceberg that we see floating over the water, we can see only that portion. But behind that, below that portion, lies a very big portion of the ice, which remains actually not visible in front of our eyes. So acute cases should be treated in that manner. I remember last year one case came to me. If I get time, I will show that case one day. And one patient came to me. He just came inside my clinic by limping. He was not being able to walk inside my clinic. He was limping. He was associated with two patients. He was assisted by two patients into my clinic. It was an acute gouty attack. Since the last night, he could not sleep. It was an acute gouty attack. And he told me that this has been happening for the last 3 or 4 years, that he has recurrent gouty attacks. So that was presented to me as an acute gout case, but it was actually a chronic gout case. So in this sort of cases, I have to first deal with the acute problems, and then I have to go deep into the case so that this recurrent attack, this recurrence of gouty problems can be obstructed. And I remember that I gave that case in the acute form Lidampal, and in the long term, I have to give Medrolizumab to that patient. So I consider these acute cases as the tip of the iceberg, or you can say that these are actually gateway to a chronic problem. When you solve an acute problem, you enter into a very bigger zone of a chronic problem. Now you have to deal with a chronic problem. So this is very important. And management of acute case, that's a very big subject. I've just summarized in one slide. In management of acute case, we have to go to organon. We have to revert back to the teachings of organon. We have to look for the exciting and or maintaining cause. Exciting cause is very important. Whenever you get an exciting cause, you can be very much sure of your selection of remedy. And if you do not get a very important, very sustainable, exciting or maintaining cause, then you can look for some peculiar, rare, uncommon symptoms in the form of sensation, modality, location, and concomitant. Very important. We have to always remember this thing. This aphorism 3, 4, 5, and aphorism this 163. These things has to be combined when we try to solve these cases. And this has been my actually, my way of practice in clinic. So this is, in short, the management of acute cases. Let me get inside the first case. The first case that I'll be dealing today is an acute neck pain in a thyroid cancer patient. It was a thyroid follicular cancer and metastatic brain tumor case. It's a very complicated case, very complicated case. You can see from the heading that the lady was suffering from follicular carcinoma of the thyroid gland. That follicular carcinoma metastatized to the base of the brain, and there was a space occupying lesion in the base of the brain involving the cerebellum. That patient actually came to me with acute neck pain. I could not take the video on the first day because it was the first day the patient, we have to win the confidence of the patient to take some pictures, to take some videos. I remember the first day when she was brought into my clinic, she was virtually hand assisted by his son and by his brother. He could not move his head. She could not move her head. She could not tilt her head. It was so acute pain. And they came to me with all the papers. They told me that she is suffering from thyroid cancer with metastasis. But now they always insisted on this thing. But now we need that you help us in this pain. She could not move her neck. It's so severe pain. So that was the thing. So this is a very deep case, a metastatic carcinomatous case, but presented to me as an acute neck pain. So I thought this is a very interesting case. So I must share this experience with all of you. 72 years old female. This is the case taking. Just you can go through the case taking. 72 years old female. She is actually a retired school teacher. She was very active when she was a school teacher. The main complaints with which she came to me on that day was acute pain and stiffness. Acute pain and stiffness in the neck, this portion. She was always showing acute pain and stiffness of the neck since 1 month, aggravated by sitting, cannot sit. Because when she was sitting, she has, there was a pain over here. So she preferred to lie or tilt on something else and turning the head. She could not turn the head. Just the head was still. So acute pain and stiffness of the neck since 1 month, aggravation by sitting and turning the head. The other complaints were inability to move the head. Cannot move the head to the sides or cannot bend downward or move upward. Cannot do any sort of movement of the neck. It was so painful. Even while eating, we have to bend. Even while talking to somebody, we have to bend. Anything involves, this movement of the neck. This portion of our body should be very flexible. But in this patient, what happened? Just the opposite happened. This portion became stiff, could not move. So it was very, very irritating, very, very, you know, uh, what I will say, very painful for the patient to bear. What are the other? You can see the picture of the patient also on the right hand side. What were the other complaints? Associated complaint was facial deviation to the right. You can see from the face that the patient had a facial deviation. It was a very, critical jumbled up case. This is from the picture, you can see that the facial paralysis happened on the left side. Just remember this face, whenever the left side of the facial nerve is paralyzed, so this portion of the muscle does not have any strength. So what happens? The other side of the face, that facial nerve, the other side, it becomes very strong and it pulls the mouth toward the healthy side. So whenever the face is deviated towards the right side, it's a case of left-sided facial palsy. So this is a typical facial paralysis. You can see the face has been deviated to the right side, and the eyes were also, the left side of the eyes, as because there was a left side of the paralysis, the face was paralyzed. The lids were not closing; it was constantly open. So the facial deviation to the right eyelid drooping. This right eyelid also was drooping, and inability to close the left eye because the facial nerve has been involved. This central nerve is also involved. The patient cannot close the lid. Why this has happened? I'm coming to that. The other complaints of the patient was she had a feeling of food getting stuck in the throat. She could not swallow properly. She can drink liquids, water, and semi-solid food, but no solid food could not be swallowed. There was a change of voice. Now, why there was a change of voice? Because this patient was suffering from cancer of the thyroid. And you remember when thyroid gland is involved, in most of the thyroid affections, we find hoarseness of voice or change in the voice. So there was a change in voice. decreased hearing on the left side because the nerves were affected, and there was cough on swallowing food. Whenever she was swallowing food, there was a reflex irritation in the throat, and she used to cough. But this was a metastatic diagnosis. The primary site of the problem was the thyroid, where the patient was suffering from follicular carcinoma of the thyroid. There are some other type of carcinoma of the thyroid also. Follicular type of thyroid is very common, and its prognosis is quite good. Prognosis is quite good in the sense that the patient survives for at least 5 to 6 years after getting diagnosis. It's not that follicular thyroid carcinoma will die within a month or within a couple of months. It's not like that. So follicular carcinoma of thyroid you can in your hand safely because the diagnosis is relatively safer. But the follicular carcinoma of the thyroid has got a probability to metastasize, where the most common locations for metastasis is a bones, especially the skull bone or the vertebra, and the next site of metastasis is the lungs. These two areas are mostly affected. Other sites may be kidney also. In this patient, the follicular carcinoma, it metastasized to the left-sided petrous bone. Petrous bone is actually over here. This is the petrous bone, you can see. This petrous bone is a temporal bone. It's known as a temporal bone. A part of the temporal bone is petrous bone. It's just located behind the ear. This is the portion. Over here, actually, metastasis. And from there, the base of the skull was affected. And from the base of the skull, see the complexity of the case. From the base of the skull, the cancer cells actually affected the left side of the cerebellum. The left half of the cerebellum was affected. So there were so many pathologies involved. But this case presented to me with only acute neck pain. So it was not such a simple case. It presented to me in a simple case, but it was actually a very deep pathological case. Left petrous bone space occupying lesion metastasized from follicular carcinoma of the thyroid. This was the metastasis diagnosis according to radiologist. Past history, when I asked for the past history from the patient, she suffered from brain stroke in July 2023. She suffered from a brain stroke in July 2023, and after that brain stroke, she had a problem with the facial nerve. She had a problem with the facial nerve, and there was actually facial palsy on the left side. Facial palsy can be due to brain stroke, can be due to affection of the facial nerve, as also there can be a very common thing that's called Bell's palsy. That is a muscular palsy. That's not a very true paralysis, but it's almost like a pseudo palsy, Bell's palsy. But this was actually a true palsy where the facial nerve was involved due to the brain stroke. There were history of multiple episodes of unresponsiveness. That means the patient's son, the patient's brother, they told me that in the past also she had some history where she was unconscious, she did not respond. But interestingly, that unconsciousness was not associated with involuntary movements of the bowel or bladder. That means whenever a person is having epilepsy or convulsion, normally we find that that epileptic convulsion or attack is associated with incontinence of urine. Urine passes out. But this lady had got a few multiple episodes of unresponsiveness, but there was no bladder incontinence. That's a very interesting point to be noted over here. And in the childhood, she got a right submandibular area operated. Maybe she could not describe it properly. Maybe she had some gland or something, some parotitis or like that, and it was operated in the childhood. She could not elaborate it. So I took a note like this: right submandibular area was operated in childhood. So this was the past history of the lady that I could obtain. And one thing you remember when you see these sort of cases, it's my own experience, and it's the experience of senior teachers over here also, that whenever you see these sort of cases, whenever you try to get more about this past history, the family history, the patient party, they become very, sometimes they become impatient, they become irritable, they always try to insist, please come to the point, doctor, please try to give some medicine so that her pain gets relieved. They doesn't understand that these are actually very essential in diagnosing, they are very essential in selecting the medicine. So while taking the case, why I'm presenting this is that I need to emphasize, especially to the youngsters, that whenever you see these sort of cases in a clinic, you're all alone. You're all alone, and in front of you, the patient is sitting with all the pain. The patient party is waiting for you, and they will be always insisting that give some medicine, give some medicine. But my advice, my sincere advice to all of you, don't lose your composure. Take a good case and select the right medicine. Now, this was the MRI report. This was the MRI report. I'll just show you. Just a minute. Yeah. This is the MRI report. You can see this is the skull bone. It has been actually affected by the metastasis. And you can see this right cerebellum is intact. This is the cerebellum. It's intact. Over here, you see the cerebellum is poorly differentiated. You cannot actually differentiate the cerebellum properly. So this, the metastatic cancer cells has actually affected the cerebellum over here also. It has affected the bone, it has affected this portion. This is the SOL. Over here also you can find it. This is the MRI report. It's of 5th of August 2023, where it's written that there is an ill-defined heterogeneous lesion in the left side of the skull base over here. And its size is 6.5 into 6.8 into 5 centimeters. Quite a big one. And interestingly, it is spanning across multiple compartments and is occupying the craniovertebral junction. The cranium and the vertebral junction, it is actually occupying that portion also. So the importance over here is that it has got all probability to, you know, to actually put pressure on very important structures which are passing through the brain to the spinal cord. Over here, you can see there is extension across the midline of the region. Sorry, the main thing is over here. Yeah, the lesion, posteriorly, the lesion is indenting and displacing the cerebellum and medulla. This is very important. It's actually displacing the cerebellum and the medulla. So there will be problem with the balancing, This is the final impression portion of the MRI report. We can just go through that report. A large heterogeneously enhancing, this is very important, enhancing, the lesion is increasing. Transcompartmental infiltrative lesion occupying the left side of the base of skull and cerebrovertebral junction with associated permeative bony destruction. Extension into the left cerebropontine angle cistern, left internal auditory canal, and neurovascular invasion is described. So, complicated pathology is already inside the patient, you can see. So this is the thing which is actually behind that acute thing. You can see the vertebra, the cervical vertebra are not so affected. These are the cervical vertebra, but you can see the mass over here. You can see the mass over here. This is the mass. This is a report of histopathology, metastatic follicular carcinoma of thyroid. Now this is a patient. This is not the first day video. I cannot take the video on the first day, but this is a video after a few days after I prescribed the medicine. You can see the video.
ভীষণ যন্ত্রণা, রাত্রে ঘুমোতে পারি না, যন্ত্রণা এত ব্যথা হয়ে গেছে যে বসতে পারছি না, আর মুখটা ফুলেছে, হ্যাঁ, কানটা একটু একটু খটখট করছে, আর মাসে কদিন মাথায় স্নান করবো সেটা ডাক্তারবাবু যেন বলেন। স্নান করতে পারছি না, ঠান্ডা লাগাই না, পাখার হাওয়ায় শুই না, অসহ্য ঘাড়ের যন্ত্রণা, বুঝতে পারছি না, ঘাড় মাথা সারা রাত ঘুমায় নাই পরশুদিন।
So those who do not understand Bengali, I just the summary is that pain and stiffness in the neck and the whole head. The patient has already been showing that this is the area which is affected, and pain is sometimes causing insomnia. This is very important. Whenever pain is not allowing you to sleep, just take it for granted that the pain is very, very severe. You have to seriously think about the pain. So this is the main thing to be solved right now. I've learned one thing from my teachers, that what is to be cured in the case. What is to be cured in the case? This is written in the organa. So right now, I have to treat the acute pain and stiffness of the neck, which is disabling the patient to move, swallow properly, and sleep. This is the main thing. I have to temporarily forget the disease, the thyroid cancer, everything. If I can cure this thing with my medicines, then the patient will stay, will persist with homeopathy. Otherwise, they will go. This is the main thing. Now, what are the common differential diagnoses of pain and stiffness of neck? Trauma to the neck or back due to injuries, a hunched posture. If somebody sits like this, or whoever carries heavy weights, they can have this back pain. Those who are walking with mobile, with laptops, sitting for prolonged time, they can have problem in the neck. Sleeping in the wrong position, sleeping with a high pillow, they can also cause stiffness and pain in the neck. High stress level, this is also very important. They can also cause pain in the neck. And medical conditions like osteoarthritis, spinal disorders, or bony changes due to metastasis. In this case, what happened? This is a rare thing, but this can also cause stiffness of the back. In fact, just for your information, I can tell you that pain and stiffness of neck can be a presenting feature of thyroid cancer. Just remember, pain and stiffness of the neck can be a presenting feature of thyroid cancer. So the first day she came to me was 26th of August 2023, and my prescription was strychnine 200. Strychnine 200 was given for the spasm, for the severe pain that she was suffering in the neck. And as because she was having bony cancer and metastasis in the bones also, I prescribed Symphytum 3x also, because this is a very specific medicine I'm using in my practice for any sort of bony metastasis, Symphytum 3x. But the main thing, the spasm, for the spasm, I prescribed strychnine 200. It's an alkaloid of Nux vomica. This is the quote from Boric. You can see its strychnine is homeopathic to spasms of muscles, stiffness in the muscles, and face of neck. This is a very important remedy. I have cured many cases of this sort of stiffness in the neck with strychnine when the conventional remedies like Arastox, Semicifuga, Paris quadrifolia, they fail. I resort to strychnine. This is a quote from Dr. Hughes' book, where Dr. Hughes writes that the homeopathicity of strychnine to tetanus needs no demonstration. It was specific for him to give strychnine to tetanus. So in tetanus, we know the main thing is spasm. So over here, the patient, the main thing, the main symptom which has to be emphasized was the acute spasm. It was affecting the patient. So that was the main reason why strychnine was selected. The other reference I got from the book from Dr. R.K. Mukherjee, who was a specialist in translating books from French authors. He also writes, strychnine offers beautiful cures of cramps, spasms are intense, muscular contraction are often painful. Next date of visit, 9th of September 2023, neck pain much better. And I repeated the same prescription because the pain was not absolutely gone, it was better. Then 3rd of November, it was 9th of September. Then 3rd of November, the son came to me. The patient did not come. The son came to me, told me that doctor, very recently there was slight increase in the neck pain. And neck pain was aggravated when bending forward, pressure. And one thing he told that even slight touch on the neck, she was not allowing any touch on the neck. So the important observation was over here, painful part is too tender to touch. That is soreness. This is called soreness. When the patient does not allow you to touch the part. It is so painful. And I asked the son, how is his mind? How is her mind? And he told me that, my mother is getting very irritable nowadays, very angry with the pain. So too angry. And physically, I got a chilliness in the patient. So I decided that the symptoms have changed. I need to change the prescription, and I prescribed HEPA-sulfur for this patient, just based on the irritation, chilliness, and the sensitiveness to touch. These 3 points actually guided me to prescribe HEPA-sulfur on 3rd of November. 5th of November, I got a report over telephone that she's much better, happy that her pain is much less now. And it has been proved, they thanked me that yes, with homeopathic medicines, acute pain can be controlled. 22nd of November, the sun again came. The patient did not come, I think. Neck pain has recently again increased since the last 2 days, and it's relieved by wearing a belt. Earlier, she was not allowing to touch. Now she's better wearing a belt, can eat and swallow food, and can lie down, but that has to be very carefully done. 22nd of 11, I again prescribed strychnine pure, the same medicine, same potency I repeated. This is 7th of December. I got a video from her son, the patient's narrative, you can see. The voice is not audible. The patient is describing that pain in neck is much, much less, but there is soreness on the overlaying area. And you can see she can move her hand, she can wear a dress, she can move her head. She could not do when she came to me on the first day. But a soreness was there in the neck.
Dr. Partha, sorry to interrupt you. If you have one more case, you have to
I have to move
present
fast.
fast.
Okay.
Because
I'm moving fast. So
question and
27th,
answer.
next visit is a last visit so far from the patient, 27th of December. You can see the patient. She was much better when she came to my clinic on 27th of December. She came by herself to my clinic without any assistance, as she could commute comfortably. Now the patient states,
ভাইউনির মানে শীতে চড়াবে দেখো
চোখ ধরে বন্ধ করুন, শব্দ মাথা এখনো হচ্ছিল না, গালটা ফুলান, গালটা। See, she can move her head very freely. একটু ঘাটটা একটু ঘোরানো, একটু টান দিকে ঘোরা। আচ্ছা, বাঁ দিকে। হ্যাঁ, বডিটা সরে থাকে, হ্যাঁ। অনেকটা ভালো করছে, হ্যাঁ। ডান দিকে। বডিটা সোজা ফাইন। হ্যাঁ, সামনের দিকে, সামনে ঝুঁকান তো মাথা থেকে একটু। এর বেশি হচ্ছিল না? পিছনে যাচ্ছে? পিছনে?
যাচ্ছে কিন্তু লাগছে
তাও নেক মুভমেন্ট অনেক ভালো আছে। ঠিক আছে। So this was the observation, can move my head to side, from side to side, can bend forward, can bend backward, though backward bending is slightly painful. But she's much better after the first visit, and she's thanked that yes, homeopathic medicines can cure this pain, can relieve this pain without any allopathic painkillers. Next prescription was placebo, and it was proven that homeopathy works wonderfully without painkillers. And please add strychnine as a good antispasmodic. Normally we prescribe Rastrux. Why did I give Rastrux? Because already a local homeopath over there prescribed Rastrux and belladonna for this patient. So I did not go for those prescriptions. I prescribed straightly. I prescribed strychnine for this patient. Next remedy that I have thought, which might come, is semicifuga. Now these are some DD of pain and stiffness of neck from synthesis repertory. Arsenic album is very good for pathological cases, degenerative changes, but the restlessness was not present, so I did not give. Belladonna, stiff neck, very good remedy, but there should be a sudden onset and sudden decline of the pain. It was not present. Causticum is another very good remedy. Cicuta is a very good remedy for this stiffness of the neck. Gelsemium, dull, heavy pain in the back with muscular weakness. Calmia, very good neck pain remedy, neuralgic pain which is radiating. Lysine or hydrophobinum, Then Paris quadrifolia, very good remedy for cervical spondylitis. Rastoxicodendron and sarcolactic acid. This is also another very small remedy, but a very good remedy for these crampy pains, especially crampy pains after influenza. After influenza with violent retching and prostration. So these are the DD I've given for you. You can keep these drugs in your mind while treating this sort of cases. Thank you. I'm moving to the second case because time is short. The second case is of acute erythema in an obstinate case of allergic contact dermatitis. I told you that these acute presentations are all gateway to a big case. So this was a allergic contact dermatitis. This case, this lady, she came to my clinic with big bunch of papers. She had been suffering from chronic allergic contact dermatitis. The suffering portion was in the fingers, itching and cracks in the fingers, and the face was red erythematous. And she had been suffering from allergic contact dermatitis since many years, and treatment was mostly allopathic medicines. And whenever she was taking allopathic medicine, it was coming down. When she was when she was taking off the medicines, there was a relapse every time. So she came to me on 6th of December, very recent case, 6th of December. Comorbidity, what are the other problems? Hypothyroidism, host of problems. Hypothyroidism, hypertension, vitamin B12 deficiency. Then there was slip disc with low back pain, gastritis, chronic liver disease. Over 30 years, she has been taking lots of allopathic medicines. I've seen in my experience that those who are taking lots of allopathic medicines, one after another, problem come to them. This is just a symptomatic presentation of this is not the actual picture of the patient. So this is allergic contact dermatitis. This is presented with redness of the skin, itching, swelling of the local portion, cracked skin, and sometimes the skin may be dry or blistered, watery. So this is allergic contact dermatitis due to some allergy. Observation over the discussion. I could find that the patient and her husband was very much allopathic minded. They came to me just, because somebody suggested. They were not at all, they were very doubtful about the recovery with homeopathic medicines. So what happened? I could not obtain any clear, dependable modality or sensation or concomitant to prescribe. On the first day, I just simply prescribed RTK urines, mother tincture, because did not get any dependable symptoms. I just waited for some symptoms to come. Now, this was this was on 6th of December. Okay. Now, on 10th of December, it was a Sunday, my holiday. Suddenly, the husband came to me and he told me that, my wife is having severe burning on her face. This is the actual picture of the patient. Severe burning on the face. And with the burning, she could not sleep for the last 2 nights. There was a dryness, there was swelling of the facial skin, and there was intense itching of the facial skin. Only relief was by applying cold water or ice pack. This was the actual picture. You can find the redness of the skin, the swelling of the skin over here. This is a magnified picture. Skin is inflamed, swollen face with burning sensation. Very, very painful. Could not sleep for 2 days, 2 nights. So the same thing I'm telling you, what is the main problem? What is to be cured in the patient? The acute burning pain in the face, which is causing insomnia. That's the main challenge. This was the repertorization. I took 8 symptoms, and in the repertorization, AP smell came. AP smell came in the first, it covered 7 symptoms with 17 points. Then Rastux came with 6 symptoms with 15 points, Ledampal, lachesis. So it was a clear-cut case of AP smell. I prescribed AP smell and I asked them to report of any untoward symptoms. That was on 10th of December. Just note the date. AP smell, this is the Metromedica. You can go through the Borix Metromedica. Now, 18th of December, the patient came to me. This picture is even more scary. The patient is recovering. The skin has become very dry, and the skin was actually, peeling off, exfoliating, the peeling off. Now, in this phase, it's a very critical phase. The patient becomes very restless. The patient party becomes very restless, and they always insist that give some medicine so that it gets cleared up. And in this phase, you have to convince the patient that you have to wait. You have to wait. Otherwise, these patients will apply some steroid creams. I told her repeatedly, do not apply any steroid creams. Do not take any steroids. Just apply coconut oil. This was on 18th of December. Prescription was placebo. And then this is the last day that she came to me on 10th of January. 10th of January 2024, she came to me and she came with a smiling face. Now you can see this face, just see this face, and now you see this face. It's totally clear, normal like before. And she couldn't believe that homeopathy can work so fast, so nicely. So this was a second case. Ideal homeopathic cure should be from inside to outside. It should come from within outward. That's the important thing. And the new skin cells regenerate from inside, which replace the disease cell outside. If this, in this way, the patient can be cured, you can be assured that these things will never recur. But with allopathy, what happens with the applying of the cream, they suppress and they go from just the opposite way of cure. So this was the second case, acute erythema. Okay, over to Bob. Yes, Dr. Bob.
Okay, sorry. Okay, thank you, Dr. Partha. You did it on time. Excellent this time. Is there anyone on the floor who would like to ask any question? Please raise up your hand. Okay. We have Dr. Beatrice Gessner. Over to you, Dr. Beatrice. You can unmute yourself. Dr. Beatrice.
Sorry, yes, I'm here now. Perhaps you could stop the screen, Dr. Partha, then we can see the faces of the participants.
Sorry?
You could stop your screen, your slides.
Oh, okay.
You could.
Okay. Yeah.
Okay, better. Yes, yes. So first of all, Dr. Partha, thank you so much for these impressive cases. Really very special cases, very well documented, and a very special example how homeopathy can work in very difficult acute pathologies. So congratulations, really very impressive. And I already know that our Latin America group will like to have you with us again to explain more about your cases.
Yes.
I'm sure. So my question would be for the first case, that very interesting that remedy strychninum you prescribed.
Yeah.
You prescribed strychninum C200.
Yeah.
My question is, was it given on a daily basis every day?
Yeah, normally I do what I do. I give strychnine in distilled water and
Yes.
I ask the patient to take daily.
To take what? 3?
I actually give strychnine in distilled water.
Yes, I understand.
prescribe this medicine in distilled water and I ask the patient to take daily.
To drink
Every day.
daily. Once or how often daily?
Yeah, in this sort of cases, I ask normally BD or TID. Twice daily or thrice daily. Twice daily was the
Twice daily
prescription.
or 3 times daily to have, that's interesting. Diluted and go on diluted, and you shake the bottle of the dilution of the remedy. You also shake the bottle.
Yeah, I ask the patient, but I'm very sure that they sometimes fail to remember this instruction.
Okay. So very, very interesting. Also the combination with heparin sulfuris, going back to strychninum. And another point, Dr. Partha, many, many congratulations, because that's exactly, let's say, the topic we all are facing in our clinics. We have chronic diseases that show up with acute conditions. And how shall we manage? If we only take the acute picture, not touching the deeper level, it will not get into a cure. And that exactly was what Dr. Hahnemann also was trying to work out for 20 years. His last 20 years, he was working on that subject because it's so difficult and it is a real art to do that.
Yes.
And
Another remedy, actually, I will share with all the people over here. I get
Yes.
a lot of cases of ankylosing spondylitis nowadays.
Yeah.
Ankylosing spondylitis, that is a very severe case of arthritis, one of the most difficult type of arthritis. Another remedy, rare remedy I use in this cases is bambusa. Bambusa.
Yeah,
Yeah,
bambus.
that's very good. Strychnine also
Yes.
helps me. The other remedy is bambusa also in this sort of stiffness where the spine becomes very stiff like a bamboo.
Yeah,
Bambusa
yes,
is a very rare remedy. When the conventional
yes.
remedies fail, you can think of the strychnine,
Bambusa.
bambusa, yeah,
For
sarcolactic
me, it's
acid.
new with strychninum. It's very interesting. So thank you very
Okay.
much, Dr. Partha.
Yeah, thank you.
Okay, anyone else?
Yes.
Dr. Prem, you speak now. Dr. Prem Pravesh have something to say.
It's
Dr. Prem Pravesh Shah. Yeah, you can unmute yourself. Dr. Prem Shah. Dr. Rem Prasha.
yes,
Thank you, Dr. Partha sir. Very nice presentation. Excellent session. Case is a very difficulty case. An acute case treat the just like chronic case. According to law of homeopathic science, a stiffness of neck is the right treat the remedy. Very kinds of remedy. Lacnanthus.
Yeah.
Lacnanthus remedy is a very good remedy. A stiffness of neck.
Yes, yes.
Very, very
Correct.
thanks, Dr. Partha. Very, very thanks. According to miasmatic, role of the according to miasmatic, treat the patient. According to sore psychotic and syphilitic, according to role of miasmatic.
Yeah.
Okay. Thank you.
Thank you. Thank you.
Okay, thank you, Dr. Ram. Just to summarize today's acute cases, for the first case, carcinoma of the thyroid that has metastasized to the temporal skull. Dr. Partha has given strychnine and followed by Hepasap. Then for the other case, the second case, regarding the chronic contact dermatitis, Dr. Partha has prescribed urticurins and followed by Apis mellifica. So there's another person who likes to ask a question. He's all the way from America. Can I invite Dr. Marion Sostino to speak now?
Yes.
Thanks, Dr. Golding. Thanks, Dr. Ganesh. Hello to everyone. Thanks for this excellent session, Dr. Partha. Thank you very much for the valuable information that you gave us. The acute case in a chronic patient is a great topic. So thanks for giving us that information. And I have a question. In the first case, how was the evolution of the patient's basic diagnosis of thyroid cancer with your intervention with homeopathy?
Sorry, can you just repeat the question once again?
Yeah. How was the evolution of the patient in the basic diagnosis? How was the thyroid cancer going with the medication?
Dr. Partha, the question is of Marian. I understood. The question is, you have been, I think so, you have been giving strychninum for the acute situation, and Dr. Marian is asking whether the chronic disease was also getting better. Well, is that right, Marian?
Yes, it's right. Thanks,
Yes,
Beatrice.
yes.
Okay. Yeah. No, actually, I'm not very sure till I conduct another MRI. Okay. But overall, the patient is feeling better. She can sleep because the pain is less and they're happy. Now,
Yes.
I'll just try to move into the deeper things. Okay, now that I've got the confidence of the patient is confident about homeopathy. Now we can retake the case once again, and we can just try to generalize the case, and we can find some new remedies like cibicifiga or any other abrotenum. Abrotenum is a very good remedy for metastatic carcinoma. Very good remedy. So this sort of remedies can come definitely over here.
Yes.
Thanks,
Very good
Dr.
question.
Partha, and
Interesting. Yes, thank you. Mhm.
thanks to all IFPH team for these great conferences. Very
Now,
Okay. Okay, there's two persons who would like to speak, and I will reserve Dr. Danesh to speak.
yes, sir.
And because I want him to say a lot of thanks, so I will let Dr. Hubert De Silva to say something. Over to you, Dr. Hubert.
Thank you, Doctor, for calling me. Doctor, it was a very nice presentation and it was a very deep one. I just got a case of metastasis throughout the lungs and everywhere. It is a prostatic gland is affected and the bones are metastasis. So in such cases, a 56 years old man, just only he called me and sent his medical report of MRI, PET scan. So, doctor, in such cases, you have treated many cases, but from your experience, how we can do in such cases immediate or how can I? What must be the pattern of that such treatment? You please give me an advice.
Yeah, actually, what I do, that thing I have presented, that this sort of cases, I just, I follow Dr. Barnett's advice. If you go through Dr. Barnett's writing, you remember, he told in one place that our treatment should be in a step ladder pattern. We have to solve one portion, then we have to ascend another step. Then by this way, we have to, in this case, I have solved this acute pain with which the patient presented. Now we have to take another, we have to retake the case and we have to see what is the totality and we have to go. In these sort of cases, I think some sort of pathological prescriptions also need to be done, like symphytum. Very recently, I got a case of aminoblastoma over here. It's a very complicated case. A big tumor over here, amyloblastoma, as well as there was another tumor in the cerebropontine. There were two tumors in that patient. So in that patient, the main thing was pain, and there was a discharge from the amyloblastoma. The discharge was falling inside the mouth. So I started with march salt because I have to relieve that particular discharge. After that discharge is stopped, I have to retake the case once again. I have to see what is the next remedy coming. Then I have to go. So this is the approach of Dr. Barnett. I've found from his practice that he used to solve a lot of these difficult cases one after another, step ladder pattern. And I remember in bone tumor cases, I give symphytum as an associate, Hecla lava sometimes as an associate. Sometimes I give thiocinaminum, all in 3x or in these potencies, along with the constitutional remedy. So I think the Barnett's approach is the best approach in these cases, step ladder pattern, one after another.
Thank you, sir. I want to ask which potency you used in the epismal case, that last burning of the 30. How often you had given?
30, I gave directly. I gave dilution. I didn't give the I didn't give in distilled water because it was a very severe burning. So I asked the patient to take 10 drops BD, 10 drops BD in this way.
Mm-hmm.
Thank you, doctor. Thank you. Thank you. Thank you very much. Great.
Thank you.
Okay.
Yes.
Is there?
Yes, sir. It's really a very good session from you, and both the cases are really excellent. And you have shown the beauty of homeopathy in managing such situation. Usually, patients come to our clinic actively or at the time of crisis when there is no possibility of continuing medication the other side of the other system. And we have to manage on those acute situations first, as you rightly pointed out in this case. And as you told, just what you see in front of you, you need to be treated first, and then you can go to the depth of the case as you are doing to Dr. Hibbert. Just this is what we used to get used to do in our clinic, and thereby, if the person is able to treat the patient at the bedside at the with the first remedy itself, definitely the patient will stick with the homeopathy, and then we will get the deep we can go to the deeper layer of the patient, and then we can able to cure the patient. Even in advancedly as you have shown that advanced pathologically cases just like brain tumor in your earlier presentations, you have shown that those situations also managed with the homeopathic medicines. And we are really happy to have such sessions from you in this platform, because this is a thing that really motivate all the homeopaths in and around the world. And not only that, we can we never thought that you have given strychnine for such a situation, because everybody was thinking of some other acute medicine for that type, because sudden pain, severe pain, usually people think of all the medicine you mentioned, but never thought that strychnine has a wonderful effect on that patient's life. And at that time, and you have even given Hepasol as a temporary remedy, and then you come back to your original strychnine, and that really give the patient relief. So this is your not only the knowledge, but your experience also is the reason that bring the patient to back to health for some more time. I think that the patient will not stick away to other system. She will stick to homeopathy itself till her life. This is what we have experienced in our early days. What's your opinion on that, sir?
Yeah. This is the way. Actually, we have to, present this sort of cases more and more. I like Dr. Hubert to be present because I know that he is also a very good prescriber and he asks very intelligent questions. So this sort of cases should be presented, I feel. So I try to present these cases, and I'm really indebted to my patients that they are allowing me to take the videos, to take the pictures. I'm really, really indebted to them. If they do not allow, then I wouldn't be able to show these cases. So this sort of cases, yeah, cancer cases are on the rise and they are coming to us. They are getting frustrated. Diabetes cases are coming to us. They are getting frustrated with allopathic medicines. So we have got a huge, immense scope nowadays. But I think only we have to make a database. That is a very important thing. We have to make a database.
Exactly.
So, is there any last minute question before Dr. Danesh close the case for the Malayalam session?
Yes, everybody has completed, sir. We can go ahead to vote of thanks.
Okay.
We can
I
invite
have one.
Dr.
I have one
Pankaj,
question.
Dr. Pankaj Parthan to say vote of thanks to this session.
Okay. Doctor.
Yes, thank you, sir. It's my first session, and it was very good experience with Parth Chakraborty sir and all of you. In future, I will also want to participate with my cases, and this is my first experience, but very nice experience, and I would like to be with you regularly. I am very thankful to IIHP for running this session from such a long time without any even 1 day's break, and it was very good organized, and I have read various subjects and all the practitioners and experienced persons from all over the world. It's a good platform to promote homeopathy at across the globe. And I am from Akola, a very small city in Maharashtra state of India, and practicing here since last 15 years in homeopathy, classical and predictive homeopathy. And it was very nice to learn from you all people. Thank you.
Those who want to watch the previous editions of our presentation, you can just visit IFPH Homeopathy in YouTube so that you can get the previous videos, almost all videos nowadays. So please search and watch again.
Yeah. Thank you, sir.
So
Yes.
this is the end of the 1,237 day of uninterrupted daily webinar. So thank you very much, ladies and gentlemen.
Thank you, sir.
Thank you. Good night.
Good night. We invite all of you to the same presentation from another doctor tomorrow at the same time, 8 p.m. Tomorrow.
Okay.
Welcome all. It is over to Dr. Mariamma John for our Malayalam session. Thank you, sir.
Thank you very much.
It's supposed to be nearly midnight in Malaysia, but we are still very, very awake because of your interesting session. Thank you very much, Dr. Partha. Dr. Dennis, and thank you, Dr. Hubert, and thank you all the way from Germany, Dr. Beatrice, and America.
Vielen Dank, Problem. Thank you. Vielen Dank.
And Dr. all here today, Dr. Panka, Dr. Sugio, Dr. Mariamma. Thank you very much, everybody. And Dr. Ram, it must be very cold over there.
Okay, sir. Okay, sir. Bye, sir.
Good.
താങ്ക് യു. എല്ലാവർക്കും നമസ്കാരം. IFPH പ്രതിദിന സൂം വെബിനാറിന്റെ 1237 ദിവസമായ ഇന്ന് ഈ പരിപാടി പങ്കെടുക്കാൻ സന്നിഹിതരായിരിക്കുന്ന എല്ലാവരെയും ഈ പ്ലാറ്റ്ഫോമിലേക്ക് സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. ഇന്ന് നമ്മോടൊപ്പം